name is Luciano Gomez Joseph, and for this project, my chosen profession is physical therapy. The scope of practice for physical therapy is a practice which encompasses the knowledge about the human body. Physical therapists will diagnose and treat patients who have injuries that inhibit their mobility. This leads to a lot of tasks for physical therapists. They also help people prevent injuries. It's a hands-on type of care which may involve putting people through exercises, and the various tasks that they may do throughout the day will include maintaining records, developing a treatment plan, assisting with equipment, performing tests, evaluating a patient's progress, and the list goes on and on. Some normally treated illnesses are arthritis, back and neck pain, joint injuries, muscle strains, and sports injuries. Some possible work settings for a physical therapist would be in a hospital, a private clinic, sports facilities, nursing homes, schools, and many other places. As a physical therapist, it would be very common to work alongside other doctors, nurses, physician assistants, physical therapist assistants. And as a physical therapist, we would work alongside these people to help come up with a treatment plan for patients. Or if I'm running my own private practice, I'll be able to oversee any physical therapist assistants that are treating patients or putting patients through exercises. Therefore, the manner of the work is it's a joint work. It's everybody's working together towards one common goal, which is treating the patient. Now, to become a physical therapist, it's not easy. One of the first requirements is to graduate with a bachelor's degree that has a focus in science. Some degrees that you could pursue to get this focus in science may be health sciences or biomed, in which your prerequisites will consist of a lot of sciences such as chemistry, biology, anatomy, and physics. After graduating with your bachelor's degree, you must then apply for a graduate program to obtain your DPT degree. To get into a graduate program, though, you must pass the GRE exam, which is somewhat like an ACT or an SAT type test. To also get into graduate programs, it is the requirement of some schools that you have at least 20 hours of experience with physical therapy. You may get that through shadowing or volunteering. After getting into a graduate program, you must then pass the state exam, which is called the National Physical Therapy Examination. This is how you then obtain your license to be able to practice. Another thing that you may be doing during your graduate school years is that you will probably be doing about 30 hours or plus clinical work, which is a lot of time. But during that time, you're going to get a lot of experience, which will help you when you get on the job. After doing that, this will total for about 3 years of graduate school. So after obtaining a bachelor's degree, which may take you about 4 years, and graduate school, which may take you about 3 years, that's a total of 7 years of education to become a DPT. Once you graduate and have obtained your license after passing the NPTE exam, it is typical for most PT students to apply for a 1-year residency, in which they can do a residency in a hospital or even do a sports residency, which is what I hope to one day do. Once licensed, your work in education is not done as a PT, because you have to renew your license on a regular basis, and you're going to gain that continued education by working in the field, and there are other professional organizations that support the field of PT. Some of these organizations are the American Physical Therapy Association, the Ohio Physical Therapy Association, the Federation of State Boards of Physical Therapy, and many others. These professional organizations provide information on how to become a PT, how to pass the national exam. They do not license you, these organizations, but they help other physical therapists come together and talk about requirements or just to support the field and help its growth. And within these professional organizations, you can find professional journals or articles that speak about different surgeries, procedures, treatment plans that other physical therapists have done. Basically, these organizations are like a big corporation to where physical therapists can come together and share their thoughts, which would just help boost the field. In the next slide, I have attached my 5-year plan, which shows my course of action for the next 5 years, or what I hope to do for the next 5 years to hopefully become a DPT. First off, in my first couple years of undergrad, I just want to continue going through my schoolwork and my coursework, getting my prerequisites out the way. Next summer, I plan on starting to shadow and volunteer at private PT offices so I can gain experience that I can use in my application. I also plan to do this so I can gain references for when I apply so I can stand out. And next fall, I plan on getting a GRE book so I can start to study for the GRE exam because I need to pass this exam before I apply to different graduate programs for physical therapy. My school that I hope to attend for graduate school is right here at USF. I like it here a lot. And upon doing that, it's going to take me about 3 years to finish my DPT program. But after those 3 years, then I'll have a chance to hopefully do a sports residency or just jump right into work. So I'll still be very young and I'll have a full life ahead of me. But I want to thank you guys for listening to my physical therapist project, and I just hope you enjoyed it.